Quick question before we get started with the show. Do you order lab tests from companies like Dutch, DSL, Genova, or Vibrant America? Hi, I'm Dr. Carrie Jones, Head of Medical Education at Rupa Health, the absolute best place to order, manage, track, and get results from 30+ lab companies all in one place. Practitioners using Rupa Health are saving well over 15 hours of admin time each week for their lab ordering process. With just a few clicks, you can order from 30+ lab companies, that's over 3,000 tests, for free in one single portal. That means one invoice for all labs, paid online upfront. Plus, patients get practitioner pricing and receive full patient support through easier personalized collection instructions, automated follow-ups, super bills, answers to testing questions, and so much more. Go to rupahealth.com to sign up for your free account today. Now, let's start the show.
Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being. Our host for Redefining Medicine is Dr. Erica Schwartz. For more than 20 years, Dr. Erica has been at the forefront of advanced patient care, taking the best from conventional and integrative medicine and applying them to prevent disease. Dr. Erica is a distinguished A4M faculty member in disciplines ranging from hormone therapy, peptide therapy, and IV nutritional support.
Hi, welcome to Redefining Medicine. Today we have Dr. Jill Carnahan. She's another changer of healthcare, and she will be talking to us about really important things. Dr. Carnahan, thank you so much for coming.
You're welcome, Erica. Glad to be here.
It's a pleasure. I think I'm going to start with your story because I think it's amazing because everybody has a personal story, but yours is really more than the usual personal story. So tell us about it, please.
Yes, so 2001, I was in my third year of medical school, pursuing my dream to become a doctor. And all of a sudden, in the midst of my surgical rotation, I found a lump in my breast. Now, I had just literally had my 25th birthday, and I didn't think anything of it, but of course, at the insistence of everybody around me, I went ahead and had it checked out. And I'll never forget sitting with a radiologist, because of course in medical school, everything's a teaching opportunity, and I'm looking at the films, the ultrasound and the mammogram, and I saw his eyes, and I knew. Now, he didn't let on. He said, oh, well, if you were 55, this would be a, high risk. It's suspicious for malignancy, but I'm 25, right? So he said, let's get a biopsy and let's see what this is. But that moment, I think, was the moment I knew internally that something was wrong. I went ahead and got a biopsy, and then I got a call from the surgeon a couple weeks later, and she said, Jill, you have aggressive breast cancer. And at that moment, I was the youngest one ever diagnosed at Loyola. Now, sadly, breast cancer has become such a scary and proliferative disease among women. There's many young women that are having it too. But when you're young, it's a whole different disease than over the age of 50 or 60. It's way more aggressive. So I was in the battle of my life. And I didn't know it then, but that was the frame of the best part of my medical education. Because all of a sudden, in one instant, I went from doctor to patient. And I lived life, what it was like to be a patient, to lose all my hair. I had 3-drug aggressive chemotherapy. The dose was right up to the maximum amount to stop my heart from beating. So they were throwing everything at it, and they were, trying to save my life. But in the process, I have no regrets because I chose to do the most aggressive course I could. But what I learned in the process is quality of life matters, and also there's so many details that we don't learn in medical school, like what it's like to have no hair and to face these decisions. I think the most profound lesson was, here I am in medical school, I have access to the best medical libraries in the world, and for me to make a decision about the best treatment, you think it's black and white, And in medicine, we're kind of taught black and white. It is so freaking gray. It's everything but black and white. And so making that decision about how to proceed and what to do was really difficult. And I tell patients now, and I share with my colleagues, when you're in the midst of those life-changing decisions, it's so critical to take the information you have at the time and to do the very best you can, but never regret. So even though 20 years later, I'm still dealing with the immune effects and multiple metabolic effects from that chemotherapy, it saved my life. And there's not one moment that I've looked back and said, what if I hadn't done that? And I think that's a great way to live, because that way you go forward and you take what you've done. And again, it gave me a really powerful story to help patients.
I agree. There's a reason you got that story. So you can change the face of medicine, really. So then what happened? I wanted to ask you, first of all, were you taking birth control pills?
I was early on, yes, and then I had stopped several years prior. And it is interesting to wonder, because I have now that I know all the backstory, I have very poor detox for estrogen, some of the cytochrome SNPs. So those things affected me. I have very poor glutathione production. I grew up on a farm with atrazine and chemicals and pesticide.
Right.
In fact, this morning, that was the topic of my talk, was how do these chemicals impact us in our environment? And my story after the cancer was looking deeper and saying, how does the environmental toxic load that we're all exposed to manifest in disease?
Right. And did you do genomic testing? And was it positive? Were you BRCA positive? What's the story with your genome?
That's a great question, because that's the first question I still get all the time. Well, genes, were you gene positive? 90-some%, I don't know the exact percentage, of women, young women with breast cancer do not have any genetic predisposition.
Right.
You know,
But
right?
did you,
Yeah,
sure.
so no,
But did
no,
you-
I did not. And
Which
so that
is-
was, which is classical. We always think,
Yeah.
oh, it's a genetic thing. No,
No, it's not.
way
We
more
know it's
environment.
environmental.
Yes.
But we know, and we've been reading, and all the data is pointing, the genes only get activated by the
Correct.
environmental factors.
Absolutely.
So there you are. So that the reason I asked about birth control pills, obviously, it was because
One more
they
factor.
suppress, of
Yes.
course, they suppress completely your hormone production. So then you got better, thank God.
Yeah,
and
yeah.
And what?
So
did
the
you do
story doesn't
next?
stop there.
Yeah, of course not. I know. That's why I want to.
Exactly. So
Yeah, tell me more.
So I got through chemotherapy. I was at the lowest weight I'd been since maybe 13 years old. I lost all my hair. Learned another word. It's called glaborious, which is hairless, and it was much nicer to say glaborious than bald. But I was bald. I had no hair, and so sick. And as we know, chemo affects rapidly dividing cells. So my gut was destroyed. And unbeknownst to me, I had also the high-risk gene for celiac and a high-risk NOD2 gene for Crohn's. So what happened was, over the following 6 months following my completion of treatment, I started having cyclical fevers, pain, weight loss, diarrhea. I just kept working, because the mentality of medical school is you don't complain, you show up unless you're dead. I mean, it's brutal, medical education. And so I kept going until one day I was in the ER about 6 months after the completion of therapy. I passed out cold on the floor. I ended up being taken that night to emergency surgery for an abscess. I'd been having fevers and I just ignored it.
Of course.
And the surgeon came out from that surgery the next day and said, Jill, you have Crohn's disease. So here I was, I'm 26 now, in my 20s. I'm not even finished with medical school, because I'd just gone back to finish my last year. And second life-threatening illness. And I remember sitting with my gastroenterologist, and he said, you know, Jill, this is lifelong. There's no cure. You're going to need immune-modulating drugs. You're probably going to need surgery over your lifetime, and very, very hopeless. And you probably need steroids right now. Well, the first thing was, I have fevers. I have an infection. I just got over an abscess. I don't think steroids are a good idea. I
agree.
Right? And so I did things differently, like I always do. And the last question I asked him before I walked out of the office was, you know, Doc, I want to do whatever I can in my part. Does diet have anything to do with this? And you know what he said. He was like, Jill, diet has nothing to do with this. And he just looked at me like I was an alien. But again, this is one of the lessons I teach patients and practitioners as well. We have this analytical mind. That's why we went into the science, and the science is amazing. But we have this intuition, and the intuition sometimes guides us as well or better than this analytical mind. And my intuition was like, that can't be true. I didn't know that it wasn't true, but I was just like, intuitively, gut and diet have to be connected.
How could they not
How could they not be connected?
Right.
So I went on a search. I had this talk about genetics, German-Swiss genetic and strong, stoic, kind of stubborn. So I was like, I'm going to prove him wrong.
Of course.
And I went on a journey, and I found diet did have, within 2 weeks of changing my diet, I wasn't cured. It took years to really heal the microbiome and feel like I am completely free of Crohn's today. But in the beginning, 2 weeks after changing my diet, I had no fevers, no symptoms, no pain. So diet did have something to do with it.
So how did you change your diet?
Yeah,
Tell us.
You got it. So the first thing I did was the specific carbohydrate diet by Elaine Gottschall years ago. This nurse found her daughter had ulcerative colitis. She found a pediatrician who'd been using this diet that took out some of the types of carbs that feed SIBO and SIFO. Now, she didn't know that. She just knew it worked, and she wrote a book about it, and she shared that with the world. And even for me, I didn't know why, but that's where I started, and I got some traction. Later, I learned I had basically had silent celiac, so taking the gluten out was huge. But I took out all inflammatory foods, so dairy, egg, gluten, corn, soy, all processed foods, sugar, and it really made a massive difference, of course.
How easy, right?
Yeah, easy, and yet it seems...
So not obvious.
Right. Yeah.
Right. So then you felt better.
Well, again, it took several years. So what I learned in there is I became the gut expert. I had to heal my own gut, and I really looked at the microbiome and how does this, and again, now, this was 20 years ago, now the research has exponentially exploded on the gut microbiome and improved, right?
Of course.
But this is before that, but I did know that microbiome, I found I had some dysbiosis, and because of the chemo, one of the chemo drugs, Cytoxan, or is known to induce leaky gut. In fact, one of its mechanisms of actions is to induce dumpage of the contents of the immune system into the bloodstream and create an inflammatory reaction that fights the cancer. But the downside of that was that I had a massively permeable gut, a risk for Crohn's, and that triggered, what Crohn's really is an autoimmune response that's abnormally aggressive to a normal microbiome.
Right.
So it doesn't always have to be an infection, and it wasn't in my case. It was just abnormally imbalanced microbe, permeability of the gut. I always say it's like tiles.
It was the chemo that did it.
Yes, and the chemo is almost like if your gut lining is tiles on a bathroom wall and the grout gets dissolved by the chemo, and all of a sudden everything pours through into the bloodstream, and my immune system's like, what is going on? This is the way, it's not supposed to be here. And then created this response that's normal in the immune system to try to take care of that, and then created collateral damage along the way. So taking out those inflammatory foods was the first step, healing SIBO, small intestinal bacterial overgrowth, small intestinal fungal overgrowth, and then any other dysbiosis, and healing the gut lining. That's how I became well from Crohn's.
Beautiful. So this was how long ago?
This was 20 years ago.
And look at you now. And look at you now.
Yeah, thank
so
you.
now you just wrote a book. Tell us about the book, please.
Oh, so Unexpected is a memoir, and people, if you're expecting a how-to book, it's got the how-to. It's got the sidebars on how to heal from mold, all the practical tips, but story is our connection and has been for generations. Even hundreds of years ago, our ancestors told story to pass down important life lessons. And as I looked at books around me, there's a lot of how-to books, or how to cleanse in 21 days, or I'm just making this up, right? They're great books, but you flip through and you get the main idea and you put it back on your shelf and you maybe reference it. I wanted a story where someone could sit down with me and have coffee, and I'm there with them, like sharing, this is what I went through, this is what I learned, and this is why it may help you in your journey.
So
the truth is, my secret is I want people to experience themselves and see a reflection in my own journey. So it's about me, but it's really not. It's the universal humanity of us all in dealing with illness, in dealing with childhood trauma, and dealing with how do we really get well in a toxic world. And I share everything very vulnerably so that the reader can see their own journeys and have hope and know that there's possibility for healing.
Well, you're just making sure that we're all one anyway, and you're proving it.
Thank you.
So when did the book come out?
March.
Wonderful, wonderful. And you'll be doing a book signing, so this is really exciting.
Thank you.
Wonderful, thank you for sharing with us.
You're welcome.
Thanks.